Hey guys, Jim here. Welcome back to Abdominal Sonography Registry Review. Let's keep rocking this test. Question 126. This type of finding has what characteristics? A. Hyperechoic rim with a hypoechoic center. B. Hypoechoic rim with a hyperechoic center. C. Hypoechoic rim with a hypoechoic center. Or is it D. Hyperechoic rim with a hyperechoic center? The answer is B, hypoechoic rim with a hyperechoic center. This ultrasound represents a patient who has a pseudo kidney. Question 127. A mass in the left lobe will cause this structure to displace in what direction? A, inferiorly, B, anteriorly, C, posteriorly, or D, superiorly? The answer is C, posteriorly. A mass in the left lobe of the liver can cause the gastroesophageal junction to be displaced posteriorly. Question 128. Which of the following does not have increased levels of ALT? A, hepatitis, B, cirrhosis, C, hemochromatosis, or D, hepatic lymphoma? The answer is D, hepatic lymphoma, because this will have elevated levels of AFP. Question 129. What is the arrow pointing to? A, adrenal neuroblastoma, B, adrenal adenoma, C, pheochromocytoma, or D, hepatic lymphoma? The answer is B, adrenal adenoma. Question 130. Histoplasmosis does not cause which of the following? A, granulomas, B, hepatitis, C, pancreatitis, or D, splenomegaly? The answer is B, hepatitis. Question 131. What can you expect to see an elevation of in this patient? A, HCG, B, ALT, C, AST, or D, ACTH? The answer is A, HCG. This ultrasound represents a patient who has a malignant intratesticular tumor. Question 132. Tuberous sclerosis is not associated with what? A, angiomyolipoma, B, hepatic lipoma, C, rhabdomyoma, or D, hepatoblastoma. The answer is D, hepatoblastoma. But tuberous sclerosis is associated with angiomyolipomas, hepatic lipomas, and rhabdomyomas. Question 133. Which is not associated with an elevated AST? A, hemolysis, B, hepatocellular carcinoma, C, hepatoblastoma, or D, hepatitis. The answer is C, hepatoblastoma. Question 134. In the transverse view, where on the sector is closest to the patient's right side? A, B, C, or D? The answer is B. This area right here. This is the patient's right side, patient's left side, patient's anterior side, and patient's posterior side. Pay attention to where this little marker is. Usually you'll see like a little P in there, but this will determine which way your index is facing. In the transverse view, when you put the transducer on the patient, the index will be pointed towards the patient's right side. So this right here tells us as sonographers that this is pointing towards the right side of the patient, which means this is the left side. Question 135. This video is not associated with which of the following? A, Marfan syndrome, B, Ehlers-Danlos syndrome, C, Klinefelter syndrome, or D, Louis-Dietz syndrome. This patient has an aortic dissection, which is associated with Marfan syndrome, Ehlers-Danlos syndrome, and Louis-Dietz syndrome, but not Klinefelter syndrome. Question 136. What are the arrows pointing to? A, adrenal neuroblastoma, B, adrenal adenoma, C, hepatoblastoma, or D, adrenal lymphoma. The answer is D, adrenal lymphoma. Question 137. Which does not have elevated levels of AFP? A, teratoma, B, hepatocellular carcinoma, C, hepatoblastoma, or D, cholangitis. The answer is D, cholangitis. Question 138. This type of condition will displace the bladder in what direction? A, superiorly, B, anteriorly, C, inferiorly, or D, posteriorly? The answer is B, anteriorly. Anytime you have a hematoma in this area, it'll displace the bladder anteriorly. Question 139. Which will not cause right upper quadrant pain? A, gallbladder sludge, B, cholangitis, C, hepatomegaly, or D, hemorrhagic hepatic cyst? The answer is A, gallbladder sludge. This type of condition is actually asymptomatic, which means that there's no symptoms. Question 140. The smaller arrow is pointing to what and is displacing the IVC in what direction? A, superior mesenteric artery and anteriorly, B, left renal artery and superiorly, C, right renal artery and anteriorly, or is it D, common bile duct and inferiorly? The answer is C, right renal artery and anteriorly. So right here is the right renal artery. This is the IVC, and the IVC is being displaced anteriorly. Question 141. All will displace an organ in the body anteriorly except A, mass in the uncinate process, B, hematoma in the pouch of Douglas, C, left adrenal mass, or D, mass in the left lobe of the liver. The answer is D, mass in the left lobe of the liver. Question 142. Which is not associated with Budd-Chiari syndrome? A, ascites, B, splenomegaly, C, elevated ALP, or D, right upper quadrant pain? The answer is C, elevated ALP, but Budd-Chiari syndrome can have mildly elevated AST. Question 143. This schematic of an infrarenal arteriovenous shunt would most likely be caused by what? A, genetics, B, inflammation, C, neoplasm, or D, biopsy? The answer is D, biopsy. Now, arteriovenous shunts can be caused by neoplasm, inflammation, and genetics, or congenital, and even trauma. But when we're talking about infrarenal AVFs, it's most likely to be caused by biopsies. Question 144. An adult kidney free of disease will represent what shape in the longitudinal plane? A, circular, B, elliptical, C, horseshoe, or D, bullet? The answer is B, elliptical. Which area on the sector will demonstrate where a pancreatic tail will be displaced by a gastric outlet obstruction and a dilated stomach? A, B, C, or D? The answer is C in this region. This is posterior. Question 146. A normal bladder free of disease will represent what shape in the sagittal view? A, circular, B, elliptical, C, rectangle, or D, square? The answer is B, elliptical. Question 147. Based on the mass location in this image, the IVC will be displaced in what direction? A, inferiorly, B, posteriorly, C, anteriorly, or D, superiorly? The answer is B, posteriorly. Question 148. A tumor in the uncinate process will displace the structure indicated by the big arrow in what direction? A, superiorly, B, posteriorly, C, inferiorly, or D, anteriorly? This arrow is pointing to the superior mesenteric vein, and a tumor in the uncinate process will displace this vein anteriorly. So the answer is D. Question 149. An adult kidney free of disease will represent what shape in the transverse plane? A, circular, B, elliptical, C, trapezoidal, or D, bullet? The answer is A, circular. Question 150. Click on the uncinate process. The answer is right in this region here. That's the uncinate process. And that concludes the next 25 questions for this test. I'll hurry and write 25 more questions and upload that video as fast as I can. If any of you have any questions about your upcoming boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can personally text or call at 435-922-1635. I'm Jim with ultrasoundboardreview.com. We'll see you next time.